So Dr. Adrinan Gaspar is a president and founding partner of Latin American Society of Aesthetic and Functional Gynecology. He's a member of the Argentinian Society of Endometriosis. He has been a member of the Argentine Society of Reproductive Endocrinology. He's an international speaker of the Slovenian Photoanalyzer Company for areas of aesthetic medicine gynecology. He lectured all over the world. You can find them everywhere you go. So we're very happy to hear from him about the effects of erbium smooth on current vaginal candidiasis with 1 year follow-up. So it's all yours now.
Well, thank you so much. It's a pleasure. Thank you so much, Dr. Ayman, for this kind invitation. Are you seeing my screen now?
Yes, we do. Yes, we do.
Okay. Well, the gist of this lecture is to show you the research and our experience that we have just published about the use of erbium in a non-ablative way. It's a trace of long pulses, actually, to the management of recurrent vaginal candidiasis. We have a 1 year follow-up. Initially, I would like to say that we know that Candida albicans is an opportunistic organism, that the infections that we may have from this fungus may range from benign problems till life-threatening invasive situations. What we have seen in the last decades is that this Candida, the infection is on the rise, but not only of Candida albicans, which is the most important that we have found in accordance with other published studies. Its incidence ranges in between 85 to 90%, but now we have other types of Candida, such as non-albican Candida such as glabrota, krusci, tropicalis, and parapsilosis. It is increasing, but actually, by definition, we have a recurrent vaginal candidiasis when we have patients suffering at least 4 attacks per year. And this definitely may affect social and sexual life of our patients. And in the majority of the cases, in this type of patients, it's difficult to eliminate the risk factors. There are a lot of risk factors that may increase the incidence of this condition. One of the most important is the adrenal fatigue, the stress, because a huge level of cortisols and then low level of cortisol will increase the presence of Candida and in our gut. Also diabetes, bad nutrition, the sugarolic diet, the leaky gut, immunodeficiency conditions, contraceptive pills, estrogen dominance. So if you see here, there are a lot of situations that we are exposed day after day. The history of treatment with the broad spectrum antibiotics is another important risk factor because antibiotic increase the likelihood of colonization by yeast because we are also eliminating the lactobacilli at the level of the vagina. In general, the prevalence of asymptomatic vaginal colonization by Candida ranges from 5 to 30% and is more frequent in diabetic women. It could be also a marker of sugarolic diets, for example. The most common sites are mucosas. The most important is digestive tube, then the oral mucosa, and finally the genital mucosa. So actually the current limitation of drugs for the treatment of this condition, because we are not talking about one acute episode, we are talking about the recurrent condition, and the prevalence of this infection reinforce the need of a different option to manage with this problem. So why laser? Well, on the one hand, because the laser light has a germicidal effect. The laser light has been used to treat onychomycosis, for example, which is a problem created by the Trichophyton rubrum, but also in diabetic patients by Candida. And also because the laser light creates a photobiomodulation. What is a photobiomodulation? Well, we know that plants, for example, they get energy from nutrients and light. but actually animals, including human being, also we get energy from light because we have some chromosphere. Our body reacts to the light exposure, absorbs the light and creates more energy because the chromosphere in our cells for light is the cytochrome oxidase in the mitochondria. Cytochrome oxidase is a chromosphere that attracts and feeds on light. So when this protein, remember the cytochrome oxidase is located in the mitochondria, in the internal membrane of the mitochondria, and it is one of the most important agents in the transportation of electrons and in the production of nitric oxide. So when this protein is exposed to infrared laser stimulation, it releases nitric oxide, which diffuses out of the cell, increasing local blood flow by vasodilation. But apart from that, it speeds up the transportation of electrons. So when hypoxic and altered cells, such as an infection, for example, are irradiated with infrared photons, there is an increase in the ATP production in the mitochondria. And this type of stimulus restores the original physiological function of the cells. So on the one hand, there will be a faster production of energy, and on the other hand, there will be a vasodilation effect, which is crucial in chronic inflammatory conditions. So to sum up, for the biomodulation increases the activity at the level of lymphocyte cells, increases also hematosis, increases phagocytosis at cellular level, increases the blood flow perfusion, which is crucial, increases also the ATP production, and modulates the inflammatory process by creating the release or promoting the release of certain growth factors and interacting with genetic transcription factors. So this is the reason why laser has been used to treat these infections in different body areas. So fungicidal and fungistatic effect too, and on the other hand, the photobiomodulation. So in our study, we included 20 women with a history of recurrent vaginal candidiasis, and all the patients at the moment of the treatment were suffering from an acute episode. So what we did cultures and for the diagnosis. The sampling for culture was obtained from the upper part of the vagina and the fornix. And in our experience, the 85% of our cases were Candida albicans and 15% Candida glabrata, according to the reported papers. The culture used medium was agar-Savaro, because it is rich, high concentrations in glucose. And the Candida needs glucose for faster reproduction. So if you see here, this is the Petri culture medium with agar-Subaru. These Candidas have 10 days of culture here. You see in 10 days how fast the Candida albicans can grow. In agreement with other studies, there was an increase in the prevalence of colonization and infection by non-albicans species, possibly related to the increased use of antifungicals and local treatment with agents of the azole group. And we have to understand that we, gynecologists, we prescribe a lot of azole agents to our patients. So there's an increasing resistance to this type of drugs. The age of our patients ranges from 19 to 47 years. So, and also it is in accordance with other papers published. The other papers that I found the age of the patients were from 15 to 45. In recurrent vaginal candidiasis, low levels of protective antibodies in vaginal secretions has been reported. Also, normally this is a condition suffered from in patients with increased sexual activity, and it is influenced by sexual hormones. And because estrogens, for example, it has been demonstrated with estrogen dominance, that estrogens increase the possibility of fixation from the yeast to the cells in the mucosa. In contrast, postmenopausal women seem more resistant to colonization by Candida. However, the incidence of vulvovaginal candidiasis increases, for example, when you prescribe to your patients hormone replacement therapy. And this is a very important factor to consider when patients after menopause tell us that they have had in the past history of recurrent vaginal candidiasis, and when they reached the menopause, they have not been suffering from that condition, because it is important. If you prescribe estrogens, you may have that possibility again. So low levels of sexual hormones are associated with lower growth of yeast candidas as a consequence of lower levels of glycogen in vaginal epithelial cells. But the problem is not glycogen. The problem is that estrogen, I insist, increases the fixation of the fungus to the epithelial cells. The symptoms of our patients were pruritus in 35%, vaginal discharge 30%, pain 15%, and 20% reported all the three symptoms, and other manifestations were dysuria and dyspareunia. The objective of our research was to evaluate the effect of the subablative long pulse of erbium laser. I call this ALPEL from subablative long pulse of erbium laser because we are using a train of 6 long pulses together in one shot. It is called a smooth mode by the manufacturer on the in vitro growth characteristics and in vivo development of Candida albicans in women suffering from an acute candidiasis infection in the vagina, but as a recurrent vaginal candidiasis. So we wanted to see the differences, if any, between the laser irradiation in vitro in the Petri culture mediums and in vivo in women. So here, this is the handpiece from the laser erbium. This is the parameter that we have used. You see 1.75 joules per square centimeter at the speed of 1.6 hertz. And this is important because we are not vaporizing we don't want to destroy the Candida has been seated here in this medium Petri culture. But if you use huge energy or huge number of stacks, more than 4, or you speed up the delivery of the energy, this is the spot size, you may destroy Candida. We don't want to destroy them, just we want to create a very light warming process to see what happens. So here, we exposed 4 plates and we used 2 as a control to see, and we did 4 applications. So you see this Petri medium culture is without laser. If you see the uniformly growth of the yeast, and if you compare this one that has been exposed to the laser, you see a significant effects in the kinetics. So again, this is a video, I think. Yes, we are doing, here you see we are not vaporizing the culture, we are just warming in a subablative way. So in the same way we work in the vagina. So this is the effect of the laser on the culture plate after 10 days of evolution. Not only was there a much lower speed of growth of Candida exposed to the laser, but also a much more irregular and non-uniform growth. So these are the parameters and standard protocol that we are using in our practice. If someone has this technology, these are the parameters that we are doing. We do 3 steps. Step 1 is the treatment of the vaginal canal. Step 2 is the treatment of the fornix, because to treat the fornix, we design a special extension to deliver the energy towards the fornix, because when you use a circular adapter or an angular adapter, that the ones we use for atrophy, incontinence, the fornix is not being irradiated, and the yeast are in the fornix too. So initially we did it manually, and now we are using a special adapter. And then the introitus. You see the canal, we use this manual set or this robotic set. Then we inserted this speculum, standard speculum, and then we do 3 passes in the fornix. It is important to treat the fornix. And then the introitus. We use lidocaine gel 5%, and we prescribe to all our patients probiotics, because this is a problem at the level of we have a leaky gut, which for sugarolic diets, a destruction of the mucosa, intestinal mucosa. We need to repair the flora from this biosis. And we did 4 sessions, one weekly session, and then 4 months after the last session, a reinforcement with another session. So the 80% of our patients improve in symptoms and in number of incidents after the complete protocol. We also did some biopsies to demonstrate the photobiomodulation effect. You see, this is an inflammatory infiltrate, chronic inflammatory infiltrate. Of course, this is a young woman. You see thicker epithelium, papillomatosis. This is not an atrophy, but this is a chronic inflammation. And if you see after the complete protocol, how this photobiomodulation promotes a complete improvement at the level of the mucosa. Only 4 patients had at least 1 episode of infection recurrence. No one registered severe adverse events. The treatment was completely tolerable. The subjective improvement was in accordance with the objective evaluation that was done by vaginal culture at 6 and 12 months follow-up. So as a conclusion, we say that the subablative lump pulse erbium laser can be proposed as an option of treatment for these type of patients, significantly reducing the pathogenicity of Candida albicans. And it can also be concluded that this technique could be a possible promising treatment for superficial mucocutaneous Candida albicans infection in this area. I'm conducting now to confirm our initial findings. I'm conducting a research in 37 countries with other users of this same technology. We are sharing the protocol. I created this forum. If someone here is working with this technology and want to join us, we are planning to publish the largest study ever done with lasers in vaginal candidiasis with almost 1,000 patients with 1-year follow-up. Please send me an email to researchgaspar@gmail.com. Thank you very much.